So hello everybody. This video is about trainee pharmacists and the foundation training year. And with me today, I've just got a recorded conversation between myself and three colleagues across South Yorkshire, hopefully to give you a bit more insight into what it's like to look after trainee pharmacists and some of the things you might need to consider. So just going to kick off with introductions. I'm Jo. I'm the CEO for Community Pharmacy South Yorkshire, which is the LPC for the region. And I'm going to come to my colleagues and ask them to introduce themselves, their role, and why they're involved with trainee pharmacists. So Barbara, I'll come to you first.
Thank you, Joe. Hi, everybody. So my name is Barbara Malik. So I am the Educational Program Director or Pre-Reg Lead for a company called Iman Healthcare. So we've got a few pharmacies in South Yorkshire, and I oversee all our trainee pharmacists.
Thanks. Charlotte.
Hi, I'm South Yorkshire Meds Optimization Program Director, and Pharmacy Integration and Development falls within my portfolio, so trainee pharmacists.
And Barbara.
Good morning, everyone. I'm Barbara Obasi. I lead on the Trainee Pharmacist Programme for South Yorkshire ICB.
Thanks, everyone. So I'm going to kick off first of all and just ask Barbara, what's your involvement been with trainee pharmacists and how many do you reckon you've looked after over the past few years of your career?
So I've been doing the role with two different organizations in South Yorkshire. So since COVID, actually, currently, Iman Healthcare have 67 trainee pharmacists. Next year, we've got 82 trainee pharmacists. So lots and lots of experience dealing with the pharmacy students and their transition into being trainee pharmacists.
Brilliant. And hence why we've got you on this call today to keep us on the straight and narrow in terms of everything we need to know about that foundation training year. Charlotte, why is it important that we are looking at the trainee pharmacist placements across South Yorkshire?
Yeah, so we did some baseline data in South Yorkshire around, particularly around pharmacy workforce, and there is a significant workforce gap around pharmacists and particularly within our community pharmacy sector. So we're really keen to increase the number of trainees in that sector. For a number of reasons, there's a lot of benefits we'll tell you about having a trainee, but also we've now got our M-Pharm, which at the University of Sheffield, and so we'll have a great cohort of pharmacists qualifying in 4.5 years. We'll be able to prescribe, so we need to put ourselves in the best position to have those trainees and retain them in South Yorkshire.
Yeah, absolutely. And Barbara, for anybody who's watching this who maybe, because we're not going to go into like a lot of the technical stuff today, but if people want to know some of the things that they need to consider if they're thinking about offering a placement for a trainee pharmacist, what are some of the practical things that they maybe need to think about? Like where do they need to go and have a look?
So they need to go and look on the essentially the Oriel website on NHS England. So there is, and that's how you actually apply as well. So it's not like a paper application form. So the link will be on the Community Pharmacy South Yorkshire website, but it's a link and it has all the information from NHS England. There's a handbook for employers. There's terms of service, so it explains all the practicalities. So as we remember from our training, it is still a 1-year program, but you can partner with other organizations. So for example, your trainee can spend 39 weeks with you in community pharmacy and then 13 weeks in another sector like GP or hospital or substance misuse as well. So you would need to be designated supervisor is the new name for being a pre-reg tutor. So you need so everyone in community pharmacy would be able to be a tutor as long as they've been qualified for at least 3 years.
Okay, so that's good to know. So designated supervisor equals pre-reg tutor in old money. I like talking in old money because that aligns with my age group. Barbara, is there anything else that people need to think about? So Barbara's mentioned the designated supervisor, the Oriole. What other things might people need to think about having practically in place for a trainee pharmacist?
So in terms of the practicalities, yes, you've talked about having a designated supervisor. We also need to have a designated prescribing practitioner, which is a DPP, and that person, that could be within a community pharmacy setting, that could be within the cross-sector placements that you have perhaps with a hospital or a GP practice, where the trainees will go and have 90 hours of prescribing practice within that setting. And just to highlight as well, because that might sound a little bit daunting, but how do we go about getting a DPP? As an ICB and within the region, we are starting to work together to make sure we've got like a database of different DPPs. So we are sort of here to sort of support with that. And there are elements of the prescribing practice that can be done within community pharmacy. So, for example, the Pharmacy First and all the other services that we offer within community pharmacy, colleagues can make the most of that. A lot of the clinical skills, the blood pressure checks, all of that does count towards the prescribing practice.
Yeah. So that, I mean, that's a really critical point, isn't it? That day to day, the trainee is going to get plenty of exposure to things that they're going to need to cover in that training year within the community pharmacy. But it's also the other thing I was just pulling on to emphasize is that ability to work with other partners to give that trainee pharmacist a really beneficial experience for the full year in terms of maybe going out and having some periods of work experience in a different sector, but thinking about, the DPPs and where they're working. There's all sorts of possibilities there, isn't there, around how you structure that time. So it is possible to think outside the box, or like sometimes we think we've got to be very much within the box, and actually you can be quite creative with that. Okay. So just to sort of pull on, because I know people might watch this who have never actually looked after a trainee pharmacist, and you can hear, quite often when you go into forums or meetings, you might hear people, oh, it's more trouble than it's worth, or there might be lots of sort of perceptions out there about it. Just from each of you, what's maybe the biggest sort of myth that sort of stands out that you've heard people say about the trainee pharmacist or foundation training year? Barbara, I'll come to you first for that.
It could be that well, the student doesn't know anything. They don't know what they're doing. They've not got any practical experience. So that used to be a myth, but the amount of placements at university have dramatically increased. So I had one afternoon at Airedale Hospital in 4 years. Now they have, it depends on the university, but they have 10 plus weeks. I think one uni had 30 weeks or so, across the 4 years. So it's a lot more experience in community pharmacy and other sectors as well.
Yeah, so the placement, the practical learning opportunities in the undergraduate program are very different, aren't they? I mean, certainly I can relate to that, having one afternoon in a hospital, and that was my exposure to it. Charlotte, what about you? What's some of the things that stand out that you've heard people say about the foundation training year?
I think it's around this is as an additional workload for me. And yes, whilst I do need supervision, but what we found in the ICB is they very much work alongside the pharmacists. So yes, there might be some level of that training initially, but then what the pharmacist finds is they can pass those pieces of work quite comfortably. So it ends up becoming quite beneficial. So I think, and as a profession, I think from my own experience, I think we're not as used to people just shadowing us all the time compared to medics. Medics always have people on the ward. So I think that's a cultural shift that, just someone working alongside you, learning from you, and then you can reciprocate that once that person, you feel comfortable and are confident to take that piece of work forward.
Yeah. I think that's a really interesting point, isn't it? That culture shift in terms of pharmacy as a profession is going through a real change, isn't it? A real paradigm change, and the way that we host trainees is part of that. And absolutely, they should be like a little appendage to you, shouldn't
Yeah.
they? Rather than seeing them as a burden to trip over. Barbara, what about you? What's some of the things that you've heard?
I think very similar to Charlotte, as I suppose from the sort of work that we do, people are I don't really have much time to train these people, but I think and as well I think it's recognizing what the expectations is from NHS England, that it's not so much different to how we've always had training pharmacists. The rest of the team can support the training pharmacist. It doesn't have to be the pharmacist all the time. So even spending time with the technicians in a pharmacy or the counter staff or the dispensers or the sort of members of staff within the pharmacy team are able to support the training pharmacist. And they are, like you say, Barbara, they have picked up quite a lot of clinical skills from their undergrad degree that community pharmacists can actually draw on just to be able to sort of enhance the training, but also free up the pharmacist under supervision.
Yeah. Okay, great. And that brings us on quite nicely to what's the reality then? So, Barbara, I'm going to come to you. What does it look like? So for your pharmacies in Iman, and the designated supervisors and the trainees, can you just sort of quickly articulate for people watching, what does a typical week look like when you've got a trainee pharmacist there?
Absolutely. So just before this, so we need a strong induction,
Hmm.
a day, a week. So the trainee needs to be clear. The rest of the team needs to be clear what the trainee can do and what they can't do. But once they are embedded in, they very quickly bring a return on investment. So in, like the multiples have their service league tables. Um, Most of the top 10 are branches that have training pharmacists in. Some of our branches have more than one, so one or two. And they can, I mean, blood pressure straight away. I don't think we need to wait any longer. They can contribute to the hypertension case finding service straight away. And they can get involved with up until the gateway point, as much as possible with the pharmacy first. So they can be used as an initial screening. And now they're contributing to NMS on the supervision, contraception service, the EHC service as well, weight management service. So getting involved is as much services as possible, and also doing things that previously only the pharmacists may have done, such as entering CDs as well, which does take sometimes up to an hour a day, depending on how many CDs you're dispensing. So, and also if you need to contact another healthcare professional, they can do that on your behalf as well. It helps them with their communication skills as well, but delegation. And people shouldn't be that concerned if they've never had a pre-reg before, because they've almost been a supervisor for the counter assistant, the pharmacy technician. They probably had students on placement. So all they're doing is they're getting someone who is actually closer to the pharmacist in education level without sounding disrespectful to the members of the team as well. Someone that actually wants to be a pharmacist. And at the start of the year, they're not that good, but that's not their fault. They haven't worked as a training pharmacist before. But by the end, in the majority of cases, we are sad to see them go.
Mm. Yeah, that's great. That's great to hear. And a really good point there in terms of thinking about it is a journey for the trainee, isn't it? From when they start with you at the beginning of the year to where they're going to be by the end of it. And it's having that in mind. You're not going to have the fully finished, polished version, because that's the whole point of why we have the trainee year, isn't it? So, and designated supervisor sounds like a grand title. But as you said, it's something that you're doing all the time as a responsible pharmacist working within a community pharmacy. Okay. Um, Barbara, what would be some of the things that you would say have maybe surprised you about what trainee pharmacists are able to do from those sort of early stages? So we've alluded a little bit, haven't we, to how the degree programs have changed and some of the experiences they get. From your interaction with trainees, what are maybe some of the surprises that you thought, oh, I wasn't expecting you to be able to do that, or does anything sort of stand out?
Yeah, absolutely. I think we sometimes underestimate, like I say, what they know. And for the trainees that we've had, We've been quite blown away from the start. How soft skills, like their organisational skills, their interest in getting into the sort of the work that they've been asked to do, their tasks, and their clinical knowledge, actually, for some of the trainees that we've had, has been quite outstanding. So I think it's just being aware. Obviously, they'll all come from different universities and all have had different trainings, but a lot of them are aware that they're going to be prescribers at the end of this, and so there is. I mean, perhaps the ones that we've had been very passionate pushing for opportunities to be able to explore what's out there for them. So that's been surprising because the stereotype of a trainee pharmacist different to what we've actually had in this last cohort that we've had of trainee pharmacists.
Really interesting. And Charlotte, I know you've said, haven't you, that the ICB you've had trainees, you've had sort of joint placements with other areas of practice. From when the ICB started hosting trainee pharmacists, what would you say have been the differences that you've noticed in terms of service delivery for the ICB team?
Yeah, so I think similar to what Barbara's saying, really, is that the cohort is quite different. So I think that's coming out now, and their training is very different. So that's been a definite. You can see that in their training and what their levels of interest. But I think also their quality improvement projects that they've done. So that has been really quite inspirational for us. And because of the level of clinical knowledge that they now have, they've taught us quite a few things as well. And actually, how can we do things differently in the ICB? So that's been quite refreshing. Particularly with my age, and then you've got young people coming out. It's just really refreshing to see that. So that's been really beneficial. I suppose really what I'm saying is that they get you to kind of think differently, and how can we do things a bit differently rather than always doing it the same way.
Yeah, because we all get set in our habits, don't we? You know, we're all human beings, and you get professional habits, and somebody else coming in and just challenging ways of working or thinking, but doing that, I mean, done in a really constructive way, it probably gives a bit of CPD back to the other pharmacy professionals that they're interacting with. Um, so Barbara, I'm going to come to you now and thinking about where we've got trainees working within community pharmacy. What would you say are the sort of the unexpected benefits that it can give to a business? You've sort of alluded to this a little bit in terms of the service delivery and the volume of services that pharmacies with trainees tend to deliver. But I'm wondering if there's anything else around sort of also the interaction with the general public and the patients using the pharmacy services.
Yeah, I mean, even the patients get quite sad sometimes with the training because they build up a rapport. Because as you know, they will, they'll probably will see a patient at least 12 times if they come in every month for their prescription, more if they're actually coming for the flu jab, COVID jab as well. So they build up a rapport with patients. But you can also use the trainees, and it's about this thinking outside the box. So if there's a campaign from NHS England or like promoting pharmacy first, they could make a display. There's different things, and you could even send a trainee to a school to do a talk to school kids or to parents about pharmacy first as well. So you're helping. Yeah, it still boils down to services as well, but um, even any reporting that you have to fill out, that was so basically everything benefits the trainee from the moment they walk in to the moment they leave. So it benefits their professional development, but also their portfolio. So that's something we haven't mentioned yet. That hasn't changed from when we did it. It was a paper portfolio when we did it, but now it's electronic portfolio. And from this year, it's mandatory to use the electronic portfolio system. So there was some hiccups in there. I think the hardest thing is logging into it, but it is quite intuitive. Um, but lots of benefits from having a training pharmacist, even for the pharmacy team as well, because they've not had someone else. So there will still be some dispensing as part of the foundation training. We can't get away from dispensing at the
Yeah.
moment, but it probably should be less dispensing and more services, even on the counter. So there's a negative perception sometimes from trainee pharmacists, but I'm only on the counter. But you're the first person the patient sees as well, yeah. And so history taking is part of prescribing. So we've already mentioned that pharmacy services can contribute, but also over-the-counter consultations can contribute. And I don't just mean a 2-1, but if you're asking lots of questions, for example, with vaginal thrush, and you know why you're asking those questions, that will contribute to the prescribing part of the portfolio. But also prescribing is important. It's only 29% of the NHS England assessment strategy. So a trainee could pass the prescribing part, but they still need to be signed off on the rest of the portfolio as well. So it's important, but it's only under 1/3 of the whole assessment strategy.
Yeah.
So everything is important in that foundation year.
So what I'm hearing from you there is actually don't fall into the trap if you've got a trainee of just slotting them into particular activities. The focus needs to be on back like when even I can even remember when I did my year, you had all those competencies and you had to think about how am I actually going to demonstrate that I've shown these competencies in practice. So it's about getting as wide an exposure to things as possible, but building on the really strong core foundation. So I love what you've said about the medicines counter. It takes me back to when I was working in pharmacy. I used to love nothing more than being released from the dispensary, and that's where I used to put myself all the time because that's where I could probably have the quickest impact and add the best value to the team. So I wasn't always the best at checking, but that's a different story. So in terms of support then whilst you're receiving a trainee, Barbara, I'm going to come to you. What support should employers sort of think about accessing whilst they've got a trainee? Have you got any thoughts there?
So there will, particularly those that haven't had a trainee before, they'll be thinking about support for who's going to be our designated supervisor, what are the requirements for those, what support's out there. NHS England, they've produced a lot of resources, but it's knowing where they are, what do I need to get out of those resources to support whoever's going to be the DS or whoever's going to be the DPP. And also, the NHS England have a strategy that they have produced, a practice strategy that is like, I can say that's the Bible that we need to really read and understand, because from that, you'll be able to structure how the training year will be for that trainee. So these are sort of the resources I would suggest to anyone who's perhaps not done this before. Have a look through the practice strategy, have a look on the NHS England dedicated sites for trainee pharmacists, and go through those documents that are really key to help structure it, and also that the training plans that needs to be produced, how the competencies that need to be signed. There's a big focus on the Miller's Triangle in this new cohort of trainees. So it's getting them to the does rather than to know how, which is where in the past we've probably always had pre-regis just shadowing. The big emphasis is that they are at the does, and we want them at the does for a lot of things quite quickly.
Yeah. Okay, great. Thanks for that. Charlotte, what would you say to employers who are worried that, they maybe don't have all the answers and know quite how to go about offering a trainee pharmacist placement?
So yeah, I think there is quite a lot of information, but in terms of NHS England are helpful in terms of filtering through that and sifting through that information. I think there's a lot of people, experienced people, so in Iran Healthcare, for example, the ICB for trainees are secondary care colleagues. So, we can share the learning. So there's lots of experience across South Yorkshire that can be shared. So I think the key thing is to kind of reach out really.
Yeah, absolutely. Use your networks. And I think we've said, haven't we, we're going to put some links through to some of those key resources onto the Community Pharmacy South Yorkshire resource page where this video is sat. So anybody who wants to read a bit more can access those quite straightforwardly. Um, Barbara, what would you say to somebody who's maybe still a bit sitting on the fence and a bit unsure about whether they should plummet and offer to host a trainee pharmacist?
But still, so the way the timelines work are a little bit strange to meet pharmacists because they, so we are in February 2026 right now. So the deadline to apply to have a trainee, and this hurts my head sometimes. So the deadline for 27, 28. So to get a trainee starting in August, July 2027, the deadline to apply is in 4 weeks. So Tuesday, 3rd of March this year. So you need to apply. And the hardest part is probably the advert. And it's 950 characters. So you have to almost sell yourself. But that's not hard. You explain, it could be location, it could be the number of services, it could be how many pharmacists you have. So that's not going to be that difficult because for a lot of trainees, they do look at location. So how close is it to the house as well? So you fill out the application, but you're not going to find out till December whether someone's actually coming or not. So one downside is that there are more places than pharmacy students. So hopefully you will get a thing, but you might apply and then in December you might find out that you haven't actually got one next year. So, but the planning can happen after Christmas. So you don't even need to think about lots of things, apart from maybe the DPP, if you've got an idea what that's going to look like. But the actual details don't need to be finalized until much closer to the start date as well.
Yeah. Okay. So there's time, isn't there? But the deadlines are critical in terms of making sure you've got to be in it to win it kind of thing. If you're not in it, you're not going to get the benefit of having a trainee.
Absolutely. And they're not flexible, unfortunately, for NHS England, those deadlines.
Yeah, so they're very firm, very fixed. Okay. So hear that loud and clear. So just to sort of try and bring us together in terms of just summing this up, I'd just sort of fire out sort of 3 quick questions, different questions for each of you. Charlotte, what would be one word that you would use to describe hosting a trainee pharmacist? Just one word.
Inspirational.
Wonderful. Thank you. Barbara, I'm going to come to you and say, what's the best moment you can think about from working with a trainee pharmacist?
The best moment, I would say, is when they actually start to be independent and you can see them grow. So it's always nice to see when they come in a little bit shy, a little bit naive, a little bit inexperienced, to the point where you can delegate responsibilities and they can run with it. For us, I think that's been the best part.
So it's really rewarding, isn't it? Really rewarding to see that. And Barbara, I'm going to come to you and say, what's the biggest lesson that you've learned as a supervisor for trainee pharmacists?
I would say you don't know everything. It's also be flexible, and you're going to be learning from the trainee. You're going to be doing the majority of the. It's not even teaching. You're just going to be doing your role, and they will, by osmosis, learn from you. But don't be afraid to learn from the trainee because we grow a year older every year, but they stay the same age, which is around about 22 as well. So, it's and also for the majority of cases, let me say, you might not remember your year 2 or year 5 of practice if we are as experienced. I'm not saying old, as experienced as us, but you never forget your pre-reg or foundation training year. And for the majority of cases, the trainees stay in touch. But then also when they leave and you get to see them going on to these amazing roles as well, benefiting patients and the pharmacy profession as well. So I think that's a good thing.
Yeah, absolutely. It's a great opportunity to act as a mentor, isn't it, for people and keep that contact going. Right. Thanks everybody. Hopefully this video just gives a little bit more of context around the foundation training year for people out there. Are you all happy to have contact details on the website as well? So if people want to make contact, though, they can do it via us at CPSY. If anybody has any further questions, but hopefully the resources in this video will help inspire a few more of you to offer a foundation trainee placement. Sorry, go
Just
on,
one more
Barb.
thing. So there is NHS funding available. So in the old days, we used to get it from the drug tariff. So now it's via MYS. And funding isn't great for pharmacy, but it's actually has increased for the trainee pharmacist grant. So you are almost getting a free member of staff, which we haven't mentioned so far.
Yeah. Okay, that's a really valid point and a nice one for us to wrap up on. So the resources there, the finances are there that fully support you having a trainee pharmacist in place. Like Barbara said, it is an opportunity to almost add to your workforce in terms of a free member of staff for that year. Right, thank you everybody. Hopefully that's given people some inspiration and a desire to look at exploring the possibility of offering more trainee pharmacist placements across South Yorkshire. Thanks everyone.